friends, welcome to my channel. I'm Natasha and today I'll be providing you with detailed information about hypertension. So click the like button if you like my video, subscribe to my channel for more such informative videos, and yeah, don't forget to share. So without further ado, let's begin. Hypertension, so what is it? It is defined as persistent systolic blood pressure of 140 mmHg or more, diastolic blood pressure of 90 mmHg or more, or current use of antihypertensive medications. So for this we need to know what is blood pressure. It is the force exerted by the blood against the walls of the blood vessel. It must be adequate to maintain tissue perfusion during activity and rest. So basically blood pressure is primarily a function of cardiac output and systemic vascular resistance. So now what is cardiac output? It is the total blood flow through the systemic or pulmonary circulation per minute. Systemic vascular resistance is the force opposing the movement of blood within the blood vessels. The radius of small arteries and arterioles is the principal factor determining vascular resistance. A small change in the radius of the arterioles creates a major change in the SVR. If SVR is increased and cardiac output remains constant or increases, arterial blood pressure will increase. Mechanisms that regulate blood pressure can affect either cardiac output or SVR or both. So hence, blood pressure is the product of cardiac output and SVR. So now getting back to hypertension, it is of two types, primary hypertension and secondary hypertension. Primary hypertension is elevated blood pressure without an identified cause, and it accounts for 90 to 95% of all cases of hypertension. This includes increased SNS activity, overproduction of sodium retaining hormones and vasoconstricting substances, increased sodium intake, greater than ideal body weight, diabetes mellitus, tobacco use and excessive alcohol consumption. Primary hypertension is the major focus of this chapter because of its prevalence and impact on health. Secondary hypertension is elevated blood pressure with a specific cause that can be identified and corrected. Secondary hypertension should be suspected in people who suddenly have blood pressure, especially if it's severe. Clinical findings that suggest secondary hypertension relate to the underlying cause. Treatment of secondary hypertension is aimed at removing or treating the underlying cause. The table here shows the normal value and the hypertensive value, hypertensive stage 1 and stage 2 values of systolic blood pressure and diastolic blood pressure. Now moving on to risk factors of hypertension. These are age, alcohol, tobacco use, diabetes mellitus, elevated serum lipids, excess dietary sodium, gender, family history, obesity, ethnicity, sedentary lifestyle, socioeconomic status, and stress. Now moving on to clinical manifestations, hypertension is often called the silent killer because it is frequently asymptomatic until it becomes severe and target organ disease occurs. A patient with severe hypertension may experience a variety of symptoms secondary to the effects of blood vessels in the various organs and tissues or to the increased overload of the heart. These secondary symptoms include fatigue, dizziness, palpitations, angina, and dyspnea. In the past, symptoms of hypertension were thought to include headache and nosebleeds. Unless blood pressure is very high, these symptoms are no more frequent in people with hypertension than in the general population. However, patients with hypertensive crisis may experience severe headaches, dyspnea, anxiety, and nosebleeds. Now, moving on to complications of hypertension, the most common complication of hypertension are target organ disease occurring in the heart. If it occurs in the heart, we call it hypertensive heart disease. And if it occurs in the brain, it is called cerebrovascular disease. And if it occurs in the peripheral vessels, we call it peripheral vascular disease. And if it occurs in kidney, it's called nephrosclerosis. And if it occurs in the eyes, we call it retinal damage. So how do we manage it? It's very important to manage. So for management, we'll go for weight reduction, dietary approaches to stop hypertension eating plan or the DASH diet, dietary sodium reduction, moderation of alcohol consumption, regular physical activity, avoidance of tobacco use, management of psychosocial risk factors. So here were certain complications and risk factors of hypertension. I hope you got some information from this video that I made. That's all for today. Thank you.